Bismillahirrahmanirrahim. Assalamu alaikum. Dear colleagues and PGs, today we shall discuss the new treatment algorithm for chronic hepatitis B in the light of recently published guidelines, that is, the Chinese guidelines published last year and WHO guidelines published on 29th March this year. And this is in accordance with the WHO target of 2030 for hepatitis elimination from the world. This algorithm has expanded the eligibility for starting antiviral treatment, as well as it has simplified the steps for initiation of the antiviral treatment.